Hey guys, in this video we're going to talk about a fatty liver and your thyroid, okay? If you have a fatty liver, chances are that's going to slow your thyroid down because, let's take it from the top. High levels of insulin from a lot of refined carbohydrates and frequent eating will put fat in the liver. You're going to get inflammation and you're going to get scar tissue, which will eventually develop into something called cirrhosis. In fact, this is called non-alcoholic fatty liver disease, okay? This can also come from being an alcoholic. So the damage from high insulin from a lot of the sugar is almost identical from the damage from alcohol, especially if you're consuming it from high fructose corn syrup, okay? Because the fructose really will damage the liver faster than other sugars. And the average American consumes 44.7 gallons of liquid sugar every single year, okay? So how do you know if you have a fatty liver? Well, if you have a gut, you're going to have a fatty liver, okay? Because the fat is spilling over from the liver around the abdomen. It's called the visceral fat. However, the best way to identify a fatty liver is ultrasound. But what's going to happen, if you have a fatty liver, the function of that liver is going to go down and the cholesterol is going to start building up too, because you're going to get a decrease of production of bile. So when you have liver damage and not enough bile, you can't effectively remove cholesterol too well. Okay, so that's one problem. And then we have the thyroid over here. The thyroid produces a hormone called T4, and then the liver helps you convert T4 to T3, which is the active form of the thyroid hormone. This is inactive, this is active. If the liver is damaged, you're not going to convert enough into T3, and you're going to have a condition known as hypothyroidism. So now you have a slow thyroid, which will then build up more cholesterol, slow your metabolism, cause more weight gain. So really, high insulin will affect your thyroid because of the liver. All right? So what do? Well, what you do is you get on keto, intermittent fasting, to handle this, okay? Increase a lot of cruciferous vegetables, increase vegetables in general to help heal the fatty liver. Over time, you can reverse this if it's not too far gone. The next thing I would recommend is choline. You can get it in a powdered form. Some people are mixing it with the electrolyte powder to make it taste better, but choline is the B vitamin to help remove the fat off the liver pretty fast. I mean, you can do it within months. So I would add that in there with really healthy cruciferous vegetables, and doing a version of keto I call healthy ketosis, and of course intermittent fasting. That's how you're going to handle the fatty liver. That's how you're going to improve your thyroid. All right? Thanks for watching. Hey guys, so I'm doing a survey of a future video, and I wanted to find out what your biggest body problem is. So that way the content is aligning with something that you are personally interested in. So please click the link down below, fill it out, and I will create the video. Thanks.